Okay, here we go. Let's try this again. Okay, I think we're back on track. So I want to start out with some information about NIHB and Project First Line. The Project First Line Collaborative is here to support the implementation of a national healthcare infection prevention and control training collaborative. NIHB's goal with partnering with the CDC on this collaborative is to develop and adapt information projects to inform tribal health professionals about critical elements of infection control. And here's a list of some opportunities that NIHB has available in support of Project First Line. We have a steering committee. We have some scholarship funds available. We host an infection prevention and control learning community. We are developing online self-paced learning modules, some job aids, and we also have a web page. Okay. And the steering committee we have in place, our presenter, Sally, is one of the members of our steering committee for Project First Line. We are grateful for our steering committee that they are here to assist us by sharing their knowledge of infection control practices so that we can meet our goal to help improve infection prevention and control practices in tribal healthcare facilities. The steering committee assists us with developing the training materials on important infection prevention and control topics. And some additional information about the steering committee. They are important for us to, for the success of this project. They help us to establish a relationship between infection control professionals and tribal healthcare officials. Their willingness to share their knowledge, personal and career experiences of infection prevention control is invaluable for this project. We also have some scholarship funds available, and we are accepting applications on a rolling basis for scholarships for tribal healthcare workers who may be interested in completing online infection control training courses. And if you are interested in any of that, please let me know. So this presentation today is part of our infection prevention and control learning community. Here is a list of some of the previous webinars NIHB has hosted. The topics of the webinars are really based on the feedback we receive from tribes who share information of the areas they would like to learn more about. And the recordings of the webinars are posted on the NIHB's YouTube page, as well as the Project First Line webpage that I mentioned earlier. The slide here has the links of some of our previous, I think I may have one or two maybe missing, but I'll make sure to update that. And the slides will be available, so you'll be able to use the links when I'll share my slides later. And lastly, so we have our online self-paced learning modules, job aids, and the web page. Our web page recently launched, and it contains information about Project First Line, tools from the CDC, as well as other partners. We have a calendar of events. There's lots of infection control events and learning tools developed with from Project First Line with the CDC and other partners. So those are all contained on the web page, and I'll make sure to share that link in the chat. And coming soon, we're developing the online learning modules, And the job aids, those will be added to the web page as soon as they're available. Okay. I am going to stop sharing here soon. Let's see. And yeah, those. Yeah, and thank you for listening about the activities we have for Project First Line. My information is here. Again, I'm Carmen Sanders. This is how you can reach me if you would like additional information about Project First Line. Okay, and next we'll get started with the webinar. I'm not sure why I have let's see here. Okay. Like I mentioned, I was having some freezing issues and some kind of okay, sorry, Sally. No, now I'm going to introduce Sally. Sally, if you don't mind, would you tell us a little bit about yourself while I get your slides going here?
I'm Sally Pinnick. Hi, everyone. I am a member of the Eastern Band of Cherokee Indians, and I work as the manager of the Cherokee Indian Hospital in infection prevention and control. I've been a nurse for many years, and I also have worked in diabetes, and I've been in infection prevention and control for the last 8 years.
Okay, thank you, Sally. Let's see here. I'm going to share again, and let's get your slides going so we can move forward with your presentation. And again, thank you all for your patience. Okay. And how are we looking here? Okay, I think we're ready. If you can see everything okay.
So today I'm going to talk to you all about COVID-19 screening and patient placement training for our frontline tribal staff. This is Cherokee Indian Hospital, and you can see it's quite beautiful. We were blessed with having a new facility built in 2015. And we have a lot of different departments that work. We have primary care, we have an inpatient department, a behavioral health department that just started this year. We have inpatient for behavioral health. We have a dental clinic and outpatient services. So learning objectives that I want you to take away today are how to utilize the assessment of your organization to identify services, guidance, and stakeholders that may impact your process. I'd like for you to be able to understand how to develop a screening and placement process, how to implement infection control measures to ensure safety for patients and employees, and be able to review the tools that I've provided and be able to develop tools for your facility that enhance successful screening and patient placement. I also want you to be able to reassess and adapt your plans to meet the current demands. And we know that we've had a lot of change over the past year, and we have to be able to adapt quickly. So when you're assessing your organization, you want to identify the services that you provide in your organization. You want to identify those that are provided by your work site, and those that you look at can guide you to develop a plan that's specific for your needs. Processes for each department may help identify key frontline staff, such as patient registration, that need education for screening and placement of patients. Guidelines are specific to services provided and may impact the screening and placement of your patients. And the type of patients that you are reviewing may impact screening and placement as well. You may have a patient that is a higher acuity or may have specific needs that you have to include in your placement. So when you assess your organization, you want to review your policies and procedures and plans. They can provide quick guidance, and they may be similar to ones that you need to develop quickly. In our facility, we use the IHS Contagious Disease Response Guidance that was given to us in 2014 to begin with. And then we had revised ours in 2019 because IHS gave us reviews for that. We were able to utilize that to develop a COVID-19 pandemic plan. And that was really helpful. Employees should be aware of and have easy access to your current policies, procedures, and plans. Employees can be involved in the development of these to promote buy-in and to provide useful input. Implementation of policies, procedures, and plans is really important. It can include a review of your systems and processes that allow sharing with your employees. Those may include electronic systems that people can go on or email. You want to allow time after the implementation of policies for people to practice those new processes you develop. You want to also have follow-up assessment and surveillance to monitor if the new processes are integrated into the daily work practices, because you want your practices in your facility to match the policies that you have developed or your plans. So another thing that you need to assess are stakeholders. Those can include employees, patients, community service, EMS, also those state guidance and federal, CDC, OSHA, WHO, some of those others. And you want to look at your schools and your other healthcare services in your area. The stakeholders are important when you're planning mass services, like for COVID vaccine, and also to ensure that the community is informed correctly. You need some of those to be physically present during your planning and implementation, have multidisciplinary teams, and others may share their valued expertise and guidance from a distance or electronically. So our hospital plan, like I said earlier, was modeled after the IHS Contagious Disease Response Guidance that was given to us. And in we did that in February. Then in March, we set up an instant command station, and it involved a multidisciplinary team and to develop preparedness to address the COVID-19 pandemic. It included executive members, managers, and supervisors of all departments participated. Teams were developed to focus on screening and testing, isolation and quarantine, protecting health services, patient care and treatment, and surveillance and containment. Some of the teams included those local stakeholders and requested and monitored, and we also requested and monitored input from surrounding areas and those guidance in IHS and CDC, in those areas that really gave us some meat to put into our plans. Also, our state, North Carolina DHHS, gave us a lot of information early on to help us develop some plans. So questions you need to consider when you're developing your screening process are what services are needed. And this can be based on what departmental needs you have? Are you developing it for an ER? Are you developing it for a dental department? Are your patients urgent or emergent when they come through the door? Can they wear a mask? Are they symptomatic for COVID-19 or have they been exposed? Have they traveled? Do they need a test? Do they need to go to lab or radiology? Are the services they need available? And can your organization provide the acuity level for the services that they need? And what are the current guidelines for that? For COVID-19 screening, patient triage before placement is very helpful. Patients should be triaged if possible, before presenting to any healthcare facility. The same triage can be utilized at entry ports to healthcare facilities. Everyone that presents to a healthcare facility should wear a mask or be presented one for wear at the entry point. They should also have hand sanitizer available to them. The standard operation practice for triage intended for use for non-US healthcare settings document can be found at the website that I gave here on this screen. And we've got a couple of future screens that are developed from there. So this is one of the triage from SOP. You want to identify if that patient that's going to present has acute onset of fever, signs and symptoms of COVID, which can include cough, malaise, headache, sore throat, loss of taste and smell. And then if you can have triage that can guide you through by if they have that symptom, then you move to a different step as indicated by the arrows. And if not, then continue a usual triage assessment and care. And this triage is for no or limited, and the next one is for widespread community transmission. And in some areas, and early on in COVID, we were not able to test, so you had to go by symptom base to know if you had a lot of patients presenting with a lot of symptoms, then you knew it was widespread over your community. This one is just for widespread. It's a little bit faster process than the earlier one. You'll always want to separate those patients that are symptomatic from others. Patients should seek emergency medical attention if the following occurs: if they have trouble breathing, persistent pain or chest pressure, new confusion, inability to wake or stay awake, pale gray discolored lips, nail beds, or skin tone. And you want to have in your protocol and process how those patients that present this way should be go through your process. Make sure you identify those and get them to the areas that they need to go to be taken care of. So when you're developing a screening process, there's several different modes of screening, and these are screening modes that we've used in our area, our facility. You can have inpatient, in-person, or telephonic pre-visit screens. In person, we usually use at all of our entrances, and then we have ER patient screening done that way. Telephonic visits, you want to make sure that you have access to telephones, and those can be done in outpatient dental and nursing areas. We utilize an electronic health record and have our CACs and our assistants in IT have been able to develop some templates that are screening tools that I'll share with you later. Self-monitoring, our employees do some self-monitoring, and we ask that our patients do that before they come to. Pre-screen visits for our telephonic for outpatient COVID testing is done. We have a electronic template that's used for that, and we have had a hotline developed that those can be shared on. We ask our patients to call into that hotline and do those pre-screening questionnaires. And if we have people that need to be COVID tested before they have a procedure, then we have a hotline that they can reach out to. We have testing done in employee entrances. For employees, we have had that done for the past year, and we've recently been able to have a decrease in our COVID and be able to self-monitor there. So the hotline's available to not only do screening, but also ask questions for patients that are calling in. This is one of our early screening tools. It allows a process. The key for this is if the patient answers yes, or you use green and follow that path, or if they answer no, you use red and follow that path. And this is just a way that you can develop a process and be able to laminate this and get it out to your screening people, usually patient registration or nurses in the ER. Then they will be able to review this with the patient before you move them to their next step. And this is also another way that you can do a cheat sheet for your staff out front, your frontline staff. And it just basically tells them what questions to ask and when to stop asking questions and move to the next step. We developed these for our frontline staff so they could easily go through those with the patients as they came through. So this is another screening tool that we've used. It's for screening everyone after they come into the facility. Or you may be able to do scripts to help people identify or help your frontline staff identify what need that patient may have and if they needed to be scheduled for testing. And there's a phone advance line tool that's located on the website that I've given you here. And on both of the last screen and this screen, the template that our facility used in our electronic health record is shared here, and I'll show you that in a little bit. That's in a larger print that you can review. But on our COVID hotline, which was telephonic screening for our COVID testing, it was answered by dedicated staff 5 days a week, Monday through Friday. And they also took voicemail that were received outside these hours. They were able to answer COVID testing questions, complete pre-screening and triage patients, and schedule patients for COVID-19 testing. If the pre-screening was not complete before a person presented for a COVID test, we had tents set up that COVID testing could be done to be doing mass testing. Then they could complete that screening when they presented. We had our Cherokee, our ABCI, Public Health and Human Services assisted this because during that time we had a lot of employees furloughed, and we were able to utilize them to help us during that time, and that was so helpful. This is the electronic screening tool that we used, and as you notice, it automatically pulled in the patient demo information, where they lived, because that's very important when you're doing COVID testing. You want to make sure that you have an address that is current for them. And you also need to ask several questions that are around how they got exposed, and if they're having symptoms, and if they're working in a healthcare facility. So our templates were developed like that, so we would be able to follow up with them easily. So when you're patient placement, you want to identify patient need at the presentation. This can usually show up in triage like we discussed earlier. You want to identify the acuity level of that patient and determine where they need to be placed. You need to develop a plan to transport the patients to their end destination. And you want to ask, can this service be provided in your organization? If it can, then you want to transport that patient to their room or wherever they're going to receive their care, utilizing PPE and safety measures to prevent the spread of infection. If not, you want to plan for transfer to a facility that provides the level of care that patient needs. And you also want to use the same measures to prevent the spread of infection. So infection control measures to ensure safety for patient and employees, you need to integrate those in your plans. The 3 W's came out really early, which was wear your mask, wash your hands, and wait 6 feet apart. And that message, we've heard that many times over the last year or so. You want to separate symptomatic or COVID-19 positive patients from other patients. They need to be placed in a single person, well-ventilated room with the door closed or in another designated area. You want to ensure that healthcare workers caring for the patient adhere to current recommendations for caring for COVID patients. Only essential healthcare workers with designated roles should enter the room and wear appropriate personnel or PPE. If aerosol generating procedures or the patient has excessive coughing, they need to be placed in a negative pressure room if that's possible. Always inform the appropriate staff that's going to be receiving that patient and will be responsible for the care. So personal protective equipment that's required by service provided. For all employees, you should wash your hands frequently. I know that all of us have heard that over and over, and this year it's really made a huge impact. Remember, COVID-19 can live on surfaces for extended lengths of time. You need to distance yourself from others 6 feet. If you're sick, stay home. And we've really tried to enforce that with our employees to make sure that if they were ill, they notified our infection control department and we advised them on staying home or testing. If you are providing clinical care, patient contact less than 6 feet, you want to wear a surgical mask. Wearing this during an entire shift will decrease opportunities for contamination of the mask. Also, we learn to save some of our masks by extending the use, and those are for a different training. You want to add gloves, gowns, face shield, and hair bonnets as indicated by the patient's presentation. and you need to don and doff appropriately. If you're providing clinical care to a patient that's positive for COVID-19 or a person under investigation that has a productive cough, is requiring respiratory treatment, or you are collecting specimens for testing, you want to use preferred PPE. If it's not available, then you want to use the accessible alternative, and people need to, or your staff needs to don and doff appropriately. And we have a screen in the next couple of slides that'll show you CDC's shared a picture that shows all that. So if you work in patient registration, or you're interviewing, counseling, screening, check-in, or greeting patients, you want to distance yourself 6 feet. All people entering the hospital will receive and wear a surgical mask or wear their own mask. Healthcare workers should wear surgical masks at all times in healthcare facilities with all patients. So here's the visual to help people, our staff members, know when to wear acceptable PPE. This can be laminated, and the information that I shared earlier can also be laminated and put in clinical areas where people need to check themselves or make sure that they're doing the correct thing to provide safe care. So when you develop your processes, you want to reassess and adapt your plans to meet the current demands. I know that guidelines have changed frequently during the past year or so, and we still require regular checks on those. It's like keeping your fingers on the pulse, trying to make sure that you stay on top of things. With changing policies and screening tools, when they're updated, you need to make sure that you share those with your employees. Teamwork to share information is extremely important. Your employees need to stay in tune with the updates and share information as well. You can share information and update by email, virtual meetings, educational systems that provide updated healthcare education and allows you to store and review policies and documents. You can update your laminated cheat sheets for your frontline staff. You need to update your policies and procedures, and you update your electronic health record templates as changes are made throughout the United States and across the world. Here are some references, and I think these are very important. I know I included dental on there, but I didn't say a lot about dental in my slides. I hope this is helpful for you, and I am free to answer questions if you have those. Thank you.
Okay, I'm gonna stop sharing the slides right now. And as Sally mentioned, we'll move on to the question and answer portion of our webinar. And I was just gonna stop sharing only because of my connectivity issues. I just wanna make sure I don't lose anything. I did ask for questions in the chat. We have one in there. I think we also have a small enough group too. If you would like to unmute yourself, we are also open to that, to ask any questions. We really want everybody to, or if you have any other information to share. Let's go with a question from Melissa. Do you have any information about negative pressure rooms? We are an urban Indian health center and may be trying to retrofit one room like this.
So when you need negative pressure rooms, usually those are set up when your facility is built. There are ways to create a negative pressure in a room. You'd have to have equipment to do that. I'm not sure what information you would like about a negative pressure room. Can you clarify that, Melissa? Other people that can be included in trying to adapt to or develop a negative pressure room can be your maintenance crew. They know how the exchange rates that should be in your rooms. You need to consider that. And you also, they would know what type of equipment. And if I can provide that to you, if you'll send me an email.
Thank you, Sally. We have another question in the Q&A from Jacob. He asks, do you have resources for measuring the effectiveness of the screening measures?
The resources for screening measures, I think you have to develop those. There may be some CDC guidelines that can assist there. I'll have to research what some of those may be and provide that at a later date. But you want to look at what your processes are, and you can follow the APIC guidelines in developing, when you develop a process, then you want to go back and evaluate how that works in your facility. If that screening process isn't working properly, then you can always change or adapt to what is happening in your area.
Okay, thank you, Sally. And I have a question from Aaron. He said, I'm sorry if I missed this, but what is your take on temp checks during the screening in regards to the CDC stating it is not effective now due to the number of asymptomatic cases?
I think that when we've reviewed some of the patients that come through, especially with our employees, and we've noticed that a lot of times they do not run a fever. They may present with other symptoms, and so that fever can be a little bit, they may have other symptoms more so than having a temperature. And I agree with that statement.
Okay, thank you. And it looks like Melissa chimed in here again in the Q&A. Melissa, would you like to unmute yourself? I think Sally also had a question of, and maybe it's something that you can discuss with her if you're unable to unmute yourself.
Negative pressure rooms have been, there are a lot of questions around those, but we did have some areas in our outpatient that we had to develop some, and I can gather the information on that and send it to you, Melissa, if you can send me an email.
Okay, so Sally, Melissa did send a message. Sorry, she wasn't able to unmute. So Melissa, if you can connect with Sally. Oh, then we have your email address there too. Well, we're happy to continue that discussion later. And do we have any other questions? Okay. And it looks like I'm still having some problems with some slowness on my computer. Were you able, I know somebody asked for the links that I mentioned. I did put that in the chat. Is everybody able to see that? Looks like it may have been just some delay on my side of getting them to go through. Oh, sure. It looks like I have a question in there from Janelle for me about the project Firstline self-paced modules. So we are developing our own. We do have some resources through the CDC project Firstline, but the ones that NIHB is developing is really based on the feedback from tribes and tribal organizations about the training that you would like to have more availability for. We do have some kind of backing up to basics of infection control. So the topics that we are developing now are donning and doffing PPE, and we have some fact sheets, job aids, or the self-paced modules will be hand washing, so just usual infection control measures, and I think the other topics. We do have some in various, but we're definitely happy to hear if there is something that you would like to see resources develop that NIHB can develop. We're happy to hear about just anything, any gaps, things that you would like to see that you can't find or is really difficult to find training tools for. We're happy to hear your suggestions and see how we can move forward with developing those. And let's see, and from Gia, is the CDC currently working on any new guidelines since the rise of the asymptomatic cases, or just going back to a phase 1 level? Is there anything that you're aware of, Sally?
No, I haven't found anything that's answering those questions that we're asking about. What do we do with the variant of COVID or new surges of COVID.
Okay. Thank you. And let's see. And Erin has, once again, sorry if I'm circling back on the topic, I've visited other locations that have self-screening. What is your take on this? Should facilities post a screener at the front, or can they use the able-bodied elsewhere and use a form or method for tech for the screening process?
We researched self-screeners kind of late in the game. I guess we had people that we delegated to be screening patients as they came through. By the time we were able to research them, our rate of COVID had significantly dropped. So we decided that it wouldn't be financially beneficial for us to go ahead and get them at those times. Now, we do self-screening for our self-monitoring of our employees currently because our risk did drop, our COVID cases has dropped.
Sorry, it looks like my link finally did just go through. It was kind of hanging. Right. It was hanging out on my screen for a minute. So, again, thank you for bearing with me with my technical difficulties here. Let's see. Did we have any questions in the chat that we missed, or also as I said, please feel free if you are unable to unmute yourself. We'd be happy to have some discussion. If you have any information to share about your experiences, we'd like to hear that as well. We really would like everybody to share your experiences. Just as take the opportunity, especially when we have a small enough group and some time as well. Let's see, I'll read some more. Okay, so if we don't have any questions or any other discussions for Sally here, I think, like I mentioned before with the project Frontline, if anybody has any information you'd like me to pass along or ideas for topics and areas that you'd like NIHB to work on developing that will support you in your work, please share that with us. And if you don't mind having some of that discussion now, we can talk about that here as well. Okay, so for the links in the chat that look like they both came up now, I'm hoping. The first one is the link to the CDC's Project Frontline, where you can find the tools that they have developed, and they also have some videos that are posted there, and also in support of Project Frontline. And NIHB's Project Frontline webpage is there as well. Let's see. Oh, I have one other question. Okay, and Sandra asks, our excellent presentation, Sally. And as will the slides be sent to the attendees, or will we be able to access them on the NIHB website? The slides will be available along with the recording on the Project Frontline webpage. And we will also send them out with the webinar survey, the post-webinar survey, within the next couple of days. The slides will be sent out, not the recording. Let's see here. That might take up too much space. And I have one more thing to share with you here. So we do have the post-webinar survey. That should come up here. So we'd really definitely appreciate all the feedback we can get about the webinar, as well as information, as mentioned, information that from you, completing the webinar. We do take all the information from taking the survey into account, and it really helps us to develop our webinars and make sure that we are reaching all the topics that tribes and tribal healthcare workers want to know more about. And we'll use that for developing future webinars, as well as the other training materials. And with that, and then do you have anything else to add, Sally?
Oh, thank you everyone for attending and for your questions.
Okay, and thank you. With that, I think we'll go ahead and wrap it up now. And I also want to thank everybody for your time. Thank you for joining us. And most importantly, thank you for all the work that you do for your tribe and your tribal organization.